Healthwise FAQ.
It's Healthwise FAQ on body and soul upsize. Thanks again for joining me, Daniel Martin. My guest on the series, Professor Robert Thomas, who is currently consultant clinical oncologist in Addenbrooke's and Bedford hospitals, as well as visiting professor at Cranfield University in Cambridge. He's been talking to us about the idea of polyphenol-rich foods and potentially this aspect of the impact they can have on certain types of cancers. Now, he led a study that we're going to talk a little bit more about. The idea is behind this study is identifying whether these polyphenol-rich foods actually had an impact on prostate cancer. The study is entitled A Double-Blind Placebo-Controlled Randomized Trial Evaluating the Effect of a Polyphenol-Rich Whole Food Supplement on PSA progression in men with prostate cancer. PSA, prostate-specific antigen, of course, is what we're talking about. So let's learn more from Professor Thomas, who's taking the time to chat with us about this for this series. Professor Thomas, what was the impetus behind this kind of study? Because what you can see very clearly is that the rigor that goes into it. Everybody knows that when it comes to medical studies, the gold standard as it is the methodology of the double-blind placebo randomized trial. That's ensconced in the titling already. Is that to give certain credence to the power that we're placing on this?
Exactly. I mean, I lead I'm chair of an organisation called Macmillan, and we are very interested in what we call survivorship. We're looking to see how we can empower patients after cancer, or maybe empower them to live a lifestyle which will prevent them getting cancer. And what we noticed, there was a large gap in the knowledge of whether polyphenol-rich foods actually have a therapeutic effect. Mm-hmm. There was lots of research done on vitamins and minerals and exercise. We also have a big exercise program and a weight reduction program, etc. So we then formed a group of scientists and nutritionalists working with a UK government organisation called NCRI, and we felt we basically looked at the research and looked at the foods which are most likely to have an anti-cancer effect.
Okay.
And then we picked green tea, pomegranate, turmeric and broccoli. We could have picked others, but those are the ones who sort of seem to be just a little bit ahead. And they work together because they work through different angles, certainly in the laboratory data. So we wanted, a bit like you're picking a football team, you want the players to work together as well as being good.
Right.
And of course, that's an hypothesis. So we then got some money off a charity. This was a non-commercial trial. And we got some funding with trial nurses from the UK government. And then, as you said, we wanted, what's the most robust trial? The most robust trial is a double-blind placebo-controlled trial. So the patients didn't know what they were taking, doctors didn't know what they were giving, and all the statistics and randomization is through an external organisation.
Okay.
So it makes it a completely kosher, robust, on a par to a drug trial, basically.
Exactly. Yes, I see these methodologies employed to drug trials all the time. As I was reading through the study, I was like, this is a drug trial, essentially, what you're doing. What was done? What was actually done for these 199 men that were part of the study?
Yeah, it was about 200. We had a few dropouts. But, so basically they took the supplement for 6 months or a placebo. And the men who took the supplement had a significant reduction in their PSA compared to the placebo.
So you actually created a supplement based on extracts from all these ingredients you mentioned?
Correct. Okay. So this didn't exist as a product at that stage. We had to design it and get someone to make it specifically for the trial and have sufficient quality assurance, of course, to be allowed to be in that format. And the idea was you concentrated these foods, you removed the sugar, you removed the bulking agent, and you just concentrated the polyphenols. So it was very rich in multiple different types of polyphenols. Mm-hmm. And we found it was well tolerated, first of all, which is good. And there was a significant reduction in PSA. We also took MRI scans of their prostate glands and saw that there was a good correlation with the MRI images of their cancers against their PSA. So in other words, we are 100% convinced that there was an anti-cancer property of this combination.
Why did you all choose to measure this in relation to prostate cancer specifically?
That's a good question, and it was just because there are a lot of men with prostate cancer, and there's not many cancers who have a group of people who have a disease which is growing, but there's no intervention required, at least initially. So we knew that there wouldn't be any other factors to dilute the effect of the polyphenols. And in the UK now, there's a large group of men going into active surveillance. So what this polyphenol product is doing is preventing a large group of that men needing to go on to androgen deprivation or radiotherapy or surgery. And the androgen deprivation actually has a lot of side effects. It makes them impotent, gain weight, hot flushes. So for men, it's actually a real opportunity to take something which can stop them feeling, pretty bad. And these are relatively cheap. So it's actually a very cost-effective initiative.
You mentioned that you were 100% convinced that there is some kind of anti-cancer activity happening in relation to this. Is it a significant amount of anti-cancer effect, though?
Yes, I mean, there was a 64% difference in the two groups, and if you know anything about statistics, it was powered to 0.0008. Put that in perspective, we were asked to present in ASCO, which is the world's biggest cancer conference, and we were given the platform for the 10 best research studies for that year, alongside 9 other drug trials, and we were the little
only non-drug trial,
the happy little story at the end. But and it was a great compliment to the research.
For fans of and my listeners who are such huge fans of the idea of finding things in the food sources around you, I know you want to know more about this. We'll continue speaking with Professor Robert Thomas next time on Healthwise FAQ. Stay tuned.
Healthwise FAQ.